We've got Rob Rutledge and Gabriella Ely, who are going to be talking about their patient empowerment program. And Brad and I met with them last year. I can't remember if it was December or November, but anyway, it was last year, and they kindly agreed to speak to us tonight. I should add that they're in Nova Scotia, which is 3 hours ahead of us time-wise. So I'm sensitive to their what time it is there. First of all, Dr. Gabriella Ely is hired as a Dalhousie Medical Research Foundation endowed Solisi research scientist in prostate cancer quality of life research at Dalhousie, and primarily appointment with the community health and epidemiology dual appointment in urology, and also across appointments in the departments of radiation oncology, psychology, and neuroscience. She began to examine the needs and challenges of men who were diagnosed with prostate cancer with the aim of actioning the findings to tangible programs aimed at improving the lives of prostate cancer survivors. She partnered with radiation oncologist Dr. Rob Rutledge, who treats prostate cancer, and they began pooling the available science to create an intervention that could actually support these men and address the health gaps in the education identified by the patients to improve their mental health and quality of life. And thus began the Prostate Cancer Patient Empowerment Program, which they have now presented across Canada and throughout the world. So join me in welcoming Gabriella and Rob, and I'll turn it over to you, and I understand you've got some slides.
Yes, my goodness, what a beautiful introduction. Thank you so much, David. It's a pleasure to see you again. We met you right before we were going to New Zealand to expand the program that we're about to describe there. So it's, and I think it was early October, wasn't it? Just before we had literally, we went around the world in that particular time. Yeah, we went and presented in Australia, New Zealand. We expanded the program there. We went to Greece, Montreal, and back home. So really around the world. That was.
I also just want to say thanks for this invitation. You know, we're presenting a program here, but we really believe that the prostate cancer support groups are key partners, right? Because you folks can identify men who would really benefit from our program, but also as men come into the program, if they're from the Alberta area or Calgary area, we'll be referring them to the prostate support group. So it works both directions. This is not just a website. This is actually something that's human and interactive and organic. And you folks play an incredibly important role in this.
Yeah, and those are the things that we hope to talk to you about. We want to give you a little bit of a background about the program that we developed, show you a mini video that we created that explains the program, share with you the results of RCT, which just got published in a Platinum Journal, European Urology.
Clinical trial, that's what it is,
and talk to you about the phase 4 expansion and an invitation for you to join us. I'm just going to go past this. You were kind enough to describe a little bit of my career in prostate cancer. But basically, we started about 7 years ago with the engagements of patients throughout. This is a bottom-up approach to science. And fair enough, it was very important because with the engagement of patients, we went through a phase 1, phase 2, phase 3, and now a phase 4 trial, identifying the needs of the patients and then tailoring those interventions specifically to the patient's needs. But basically, 6 years ago, we uncovered a silent epidemic of loneliness and disconnect among men diagnosed with prostate cancer.
And poor mental health, like
poor mental health.
Depression, anxiety are like 2 or 3 times as high, right?
Right. Yeah. And those results were not just stemming out of our sample size. We had about 500 men that took a survey in Maritimes, Canada. So that's Nova Scotia, New Brunswick, PEI. But then we went to independent data sources like a database in Atlantic Canada, and then one that covered Canada, the Canadian Longitudinal Study for Aging testing, and the results were the same. But those results were unique in that nobody before that talked about those issues among prostate cancer survivor. And what you're seeing here is just a synop of a very comprehensive survey using golden standard questionnaires. And what you're seeing here is our website. So if you go there, you get to see an introductory video of the program. You can find out about the various principal investigators. We have now sites throughout Canada and internationally. And this is how you join the program. There is an information sheet here that you fill out, and people from our team contact you and get you enrolled in the program. Yeah. But what we want to do is just play very quickly this video. It's about 9 minutes long that explains the program so that you have a better idea. Visuals are always helpful. So hopefully this will be a little helpful.
Do you want to take an active role in improving your mental and physical health after a prostate cancer diagnosis, decrease side effects like fatigue and urinary leakage, and improve your chances of not dying of prostate cancer? Then PCPEP, the Prostate Cancer Patient Empowerment Program, is for you.
PCPEP grew out of my lab's research studies showing that men affected by prostate cancer suffer from high rates of treatment side effects, which can negatively affect their mental health and quality of life. So we engaged the community. We engaged patients and partners, urologists, oncologists, stakeholders, and other experts, and created a home-based, comprehensive program tailored for prostate cancer. Since then, we conducted and published several scientific studies, including a pilot study testing and showing that PCPEP is safe and feasible, and also the results of a randomized clinical trial of 128 patients testing PCPEP against current standard of care. The results of the study shows that PCPEP improved mental and physical health, urinary function, and overall quality of life. The feedback we received from the PCPEP program has been incredibly positive from the men in the program, their partners, and their doctors.
My wife and I had the benefit of being a part of the development of the PCPEP program, and we're going to be sharing some of our experiences.
So in this video, you're going to learn all about the program and find out what you need to do to get started.
And I'll be sharing some of the things that were particularly helpful for us.
PCPEP is meant to start before any treatment begins, although men can do this program at any point on their journey. We believe that men undergoing treatment, whether it be surgery, radiation, hormone therapy, chemotherapy, or active surveillance, will benefit from this program and experience increased energy, better cognitive function, and overall improved quality of life in the long term.
Once you've been cleared to participate, you can start the program. You will receive an email every day for 6 months, which tells you what you should be doing for that day. In the email is a link to a 4-minute YouTube video which contains our daily message, in which Gabrielle and I try to put some pep in the PCPEP. We provide the scientific background for the program, provide advice on the anti-prostate cancer diet, and tell you about how to stay connected with loved ones, and much, much more.
Most guys in the program read their emails and watch the video first thing in the morning with their partner if they have one.
Yeah, and the videos are entertaining and very positive and really informative.
The program is set up on a weekly schedule and composed of 5 major activities. First is aerobic exercise. We want you to get out there almost every day and get your heart rate up and a slight sweat on the brow and really get yourself going. And even if you power walk, it's been proven to be beneficial. And as you slowly increase your activity over the program, we want you to get to and beyond the recommended 150 minutes of moderate exercise every week. On Mondays and Thursdays, you'll receive links to these 30-minute strength training videos, which you'll do from home. Each of the videos has 9 diverse exercises that use either elastic bands or your body weight. And the idea is that you choose the difficulty level that you want to start with, and as the weeks and months go by, you'll increase the difficulty level. The program is also meant to be modified if you're having problems with a particular exercise. If you're undergoing surgery, obviously you'll have to take a break from the strength training program for at least 4 to 6 weeks, or however long your urologist recommends. The advice from the medical system always trumps the general advice we provide in the program.
Your wife or partner can participate in any of the activities of the program if they like. For instance, the strength training.
Yeah. Or going out for walks together again. That was great, getting back to that. Yeah.
The next component of the program, Kegels, also called pelvic floor muscle training, has also been a huge hit in this program, especially for men going through or recovering from surgery and men who have urinary problems. Kegels can also help with erectile and bowel function. We're asking you to do 10 minutes of Kegels 3 times per day. The program can also arrange for you to receive 3 text reminders every day. Each week, the Kegels videos change to make this a progressive training program. You'll also learn key skills which decrease the chance of urinary leakage while training, a skill which you can use for the rest of your life.
The third component is practicing a relaxation technique. The science is very strong that this will improve your mental health and improve multiple other medical conditions. Preferably, you can use a heart rate variability monitor to train your nervous system and actually decrease your stress levels. The monitor clips onto your earlobe and measures the heart rhythm as a way of providing you biofeedback. We'll remind you through an email every day to practice for 10 minutes, and you can also follow one of our videos.
The fourth component of the program is dietary advice. Every day we provide tips in the emails and videos we're sending you to help you transform your diet towards the best anti-prostate cancer diet. We're drawing on the best science and provide practical advice about how to shop and how to prepare those dishes. In addition, we created a series of anti-cancer diet cooking videos where we teach you how to prepare delicious, nutritious, and cost-effective plant-based meals.
The fifth component, relationship and connection training, comes through in multiple ways. Gabriella is a psychology professor with a lot of experience teaching people how to stay more connected with their loved ones. There is a science and methodology to improving our relationships.
Throughout the week, we encourage you to connect more deeply with your loved ones, whether you have a partner or not. We talk about intimacy, sexuality, communication, and how our relationships play a key role in health and healing. There is Walking Wednesday, Touch Tuesday, Call Someone at a Distance on Sundays. We talk about the various types of intimacy and communication techniques. This aspect of the program facilitates and offers a great opportunity to learn key skills on how to connect more deeply with the most important people in your life.
I really liked and benefited from the buddy and mentor aspect of this program. Having a mentor, someone who's gone through this before, and to be able to call them and interact with them was really great for me. Having buddies, people who are in the program, one or two other people where you call once a week and encourage to keep up with the exercises, that was great. We also encourage people to get involved in a local prostate cancer support group in your area, and it's to have other people around you and learn more about how to cope with this disease was very helpful. Once a month, we have a conference call where everybody who's involved in the program at the present time get together on Zoom, interact with each other, and hear from Gabrielle and Rob. And a real community has developed there.
PCPEP is free for you to join if you participate in a research study in which we measure your quality of life by an online confidential survey just before you start the program, and then at 6, 12, and 24 months later. In addition, every Sunday during the 6 months program, we would like you to fill out a 2-minute online survey on what you did the previous week. This is important for us because it helps us develop patient education and empowerment programs tailored to patients' needs. In fact, this is how we got here.
The PCPEP program was really timely for us. It's a very comprehensive program, and it brought us from diagnosis right through all the stages of treatment, and it was absolutely super.
Well, when I started my hormone therapy, I felt like I went from being 57 to 75 years old overnight. But the program gave me some things to do. I got more active. I lost 15 pounds and committed to connecting more together with Pat.
Yeah.
Please join our program by visiting our website, www.pcpep.org. We'll take you through the steps to make sure it's safe for you to exercise and do the strength training, and make sure you have all of the equipment before you get started.
We're excited to have you join our program. Join our community of mentors, ambassadors, and research citizens promoting this program to other men in the community. This community has grown so much over the past 5 years, and it keeps on growing. We look forward to healing and connecting with you soon on a monthly video conference.
Second time I watched it today. Still is a good video.
All right, so we're just going to jump right into the water here. We conducted a randomized clinical trial. There were 128 men in the trial. They entered at the time when they had their either surgery or radiation scheduled. So they were diagnosed, they met with their clinicians, and they had either surgery or radiation plus or minus
curative side,
hormonal therapy scheduled. Half of them got randomly assigned to the intervention that you just saw being described here, and the other half followed the usual care. At the end of the 6 months, we assessed them again, and we did a comprehensive survey. At the end of the 6 months, the gents that were in the control group, we call it also the wait list group, they got the intervention for 6 months until the end of the year. So what you're seeing here, and the results are just in print as we speak, in European urology, is that at 6 months, men who received the intervention had by and large much better non-specific psychological distress, so very little psychological distress, less anxiety, less depression, compared to the men that followed the usual care, whose distress went up, anxiety went up, depression went up. From 6 to 12 months, there was no statistical significant difference in their increase in non-specific psychological distress, but their anxiety continued to grow and their depression didn't differ. However, when we compare the early versus the late group, clearly getting the intervention as soon as you get diagnosed was best. These results were also clinically significant, showing that men who followed the standard of care had almost 4 times higher odds of screening positive for psychological distress and need for clinical treatment compared to the people who received the intervention. What you're seeing here are results we're just beginning to publish now. This is a paper that we're about to submit a Journal of Urology, showing that men who were in the program also at 6 months had better urinary function, had less urinary obstructive scores, less incontinence compared to the men following the standard of care. They also lost weight compared to usual care. And the gents that got the intervention at 6 months also lost weight. So the program is quite effective. To enroll in the study, you go on our website, www.pcpep.org, and I'm going to type the website in the chat, and you just enter your name, place of residence, email and phone number, and somebody from our team gets a hold of you to enroll you. But right now we expanded the eligibility for the phase 4 implementation trial to include men with metastatic disease that have an expected 2-year survival rate and they're safe to exercise. Men with active surveillance are also welcome. So pretty much everybody and anybody at any point on their journey. So this is just a brief comment about the program has taken off like fire, pretty much. The randomized clinical trial was completed in March last year. Since then, we opened sites
It's actually 10 out of 10 provinces.
10
that-
out of 10
that
provinces
are
now,
interested.
and New Zealand.
Edmonton will open shortly,
Yeah.
actually. Yeah.
Those are just some of the leads PIs throughout the world. This is a lead in New Zealand, lead in Ontario, New Brunswick. This is a research citizen. We have a lot of the men in the program. They come and they remain engaged in the program. They keep attending the monthly video conferences. After they finish the program, they're not just research citizens, but they become mentors. Bernie Petolas attends every single lab meeting we have. He's just as much as they're just as much as members of our team than we are. Those are some of our staff, but we have PIs in every province in the country now, and those are all urologists that have been involved in the program. And we very much need you.
Yeah.
We have a very diverse group of men. We have gay men in the program. We have straight men in the program. We have partners that now are beginning to outreach, and they're forming their own group, and they are advocating the program throughout the country. So
Yeah.
very much looking forward to hearing from you if you have any questions.
Yeah, and just to say the ask of your group is to try to identify at least 2 men who would be interested in actually doing the program. I think I mean, the program sells itself. It's the patients then go back to the urologist and say, this is a great program. Why isn't this being offered? And it's too bad there aren't better systems in place, right? This afternoon, I was with a urology resident, and we gave a Zoom seminar to, it was like 42 guys who were scheduled for radical prostatectomy, and we pitched the program, and at least half the guys will participate. It's not to say the program is for everybody, but I think there's a good portion of the population, probably 1 in 3 men, who would really benefit from this. And we're just in the point now where we're looking at the data further to find out what the other benefits are. So
another interesting point of interest for you as a support group is that among the many things that we assessed was also attendance to support groups. So of course, when the 128 men entered in the program, none of them were attending support groups. By 6 months, the men that were in the PCPEP program, because we endorse prostate cancer support groups so much, more than half were attending, in addition to our program, their local support group, like you heard Ross talk about. He's the lead support group in Nova Scotia. So, we endorse that men reach out locally and they engage their local support groups. So very interesting. So by 6 months, more than half of the men in the intervention group attended support groups, and only 10% of the gents that followed usual care were involved in a support group. By the end of the year, all men had very high percentages of attendance. So it's interesting.
yeah.
Yeah.
We could
thank
talk
you very much, Gabriella and Rob, and I'd invite the group to ask any questions of you while you're here.
Hi, it's Brad here.
Hi, Brad.
So good to see you again. Yes, thank you for making time for us. That's so great. I think I saw a slide, one of you in your presentation, where there's benefit even for gentlemen who start 6 months down the road, or
Yeah.
I
For you,
understand.
confidence and weight loss. Yeah.
Yes, I understand the goal is to get men enrolled as soon as possible after diagnosis, before treatment. But if it's after treatment, are they still eligible for the program at this point? Is part of your trial? Or?
Yeah. So the phase 4 trial, really, it's men all the way from active surveillance at any point in time up to metastatic disease, as long as they can exercise and have a 2-year survival. And so what we think about is there's science to show that if you do your Kegels and your pelvic floor stuff before surgery, you get drier faster. But Gabrielle is basically saying even the guys that started the program after they had their surgery, they also had improvement urinary disease. Now they would have got their urinary better anyways, but just think about it. Starting hormone therapy, there's all sorts of side effects that this program would benefit. And, going into any treatment, we know that by exercising, practicing relaxation technique, men have more energy and get through their treatments more easily. So really, you can think of it now, the phase 4 trial is really this very, very, very wide spectrum of men. And we encourage like diversity there too, so we can understand, who can benefit.
Yeah, and we kept the presentation tonight relatively short because we have so much data. We have data on quality of life. We have data on compliance. So what the results of compliance, that's another manuscript that Jesse Spooner, one of our urology residents, is presenting at the ESMO this year. But basically showing the men overperformed the requirements of the program. And rest assured, this is not each day we're asking men to do about 70 minutes of various things. So you would think, wow, that's a lot of time. And then weekly compliance surveys, wow, that's a lot. Well, no, they are so compliant, not just the intervention group, but also the men that got the program at 6 months. So for 6 months, they were in the standard of care. Then they got the program. They're equally compliant. And that's just fascinating. When we did the phase 2 trial, I remember interviewing men and saying, please tell me that you're tired of those weekly compliance surveys. And they said, don't touch them.
Don't take it away, yeah.
I said, well, why? You don't understand, do you? I said, no, I don't. And they said, every week we know you're going to ask questions. Have we done this? Have we eaten less fats? Have we eaten more avocado oil or try to use, have we eaten this? Or have we used our exercise bands? Because we give all men in the program free exercise bands. We give them a stress reduction monitor. Have you used this? Have you done this? How do you think I'm doing so well? I'm paying attention because I know at the end of the month, not only would you... At the end of the week, you do a survey. At the end of the month, I have to see you in your eyes. I have to look at your eyes. You and Rob, and you guys done so much for us. You don't understand. That's the best thing that you could come up with. And it's so counterintuitive. That's why I keep telling my colleagues, don't just ask men questions. Engage these men as partners in your research. We got here where we are because they're, as I said, they attend lab meetings. They have a say. It's not just, oh, how about you giving me a response? Like, that's wonderful. Of course, data is very important, right? Yeah. But it's important to hear from the wisdom of people going through this. Yeah. It's absolutely vital. Yeah. Research that is done otherwise ends up on a shelf. Yeah. Nobody uses it.
Agreed. Like Shaminder, in a sense, is that same process, right? You go to the experts. So and that's how the program was developed.
Yeah.
Long answer, Brad.
We used to have a saying. We used to have a saying in business: "What gets measured gets done." And, if you're not keeping track, then
measure
nothing happens.
Exactly.
And we have so many. We have initial treatments, then we have secondary treatments, third line treatments. There's so many entry points where you can make those lifestyle changes and see the benefits. So it's great that you've opened it up to so many gentlemen, because now doesn't matter where they are in their journey, they can access this. So that's great news.
I'll just make one more point before Shaminder jumps in again. This is not a competitive program. We're not trying to compete with Excel or any other exercise program. We're not trying to compete with the pelvic floor nurses that work in the Calgary Center. The idea is the guys are getting emails every day to remind them to empower themselves, to reach out and tap into those other programs and really make a difference. So you can still do Excel or whatever else, whatever Calgary has to offer, and our program as well. Go ahead.
When you say it's really good to get men that have just been diagnosed and maybe after the shock of diagnosis and that, but to get them early. And so I'm wondering, have you had any chance of touching base with urologists or oncologists in Calgary or Edmonton, for example?
Yes, we actually have a site in Edmonton that is just about to open, and also one in Red Deer coming up.
Red Deer as well. Yeah, I mean, I really think that if we can get even just a few men from the Calgary area to do it, it
That would be just
it
great.
speaks volumes.
That's
and then,
it.
Then we can approach the
We don't need to promote the program. The
Calgary-
men will speak for themselves.
exactly the Calgary urologist, radiation oncologist will jump on board because it's so easy for them. It's like 10 seconds at time of presentation. Like, we think this is really important. I want you to do this program. Go to pcpep.org, hand over a pamphlet. It takes 10 seconds to do and can really make a difference in men's lives. So.
We strongly encourage you when the paper is published. So we think within a week or two, the embargo will be released. The paper will be available online. Please have a look at it because European Urology insisted. We had 7 reviewers, including the statistical editor of the journal, endorse the paper. And they insisted that all the ratings, we had exit interviews, and then we had quantitative surveys, assessing the team, assessing Rob and I, assessing every aspect of the program. And to see their endorsement, it's chilling. Chilling, really.
Yeah. Looking for volunteers.
Whenever those sites in Edmonton and Red Deer, when information's available, I'd be interested in receiving that, because I'd like to connect with them to see how they're doing and how they're working it out in those 2 centers, because they're so close and they're dealing with the same challenges that we would have. So I'd appreciate that if you could share.
Sure. As soon as it gets going, we'll keep you guys in the loop as well. I mean, it is a free program in that people, like, they don't have to go through their urologist to do this. Like, anybody anywhere who has a prostate cancer diagnosis can just go to the website and sign themselves up.
Yeah.
So we have the funding to do that. Now, we want the sites, Howard Evans is the name of the urologist in Edmonton. We want those sites to actually have their own data, because they're actually collecting very comprehensive data on their patients, 0, 6, 12, and 24 months. And so it's in their advantage to kind of get that data for their patients, so they know how their patients are doing. Yeah. So we do want the kind of the science to go forward. In the meantime, we're really trying to serve the prostate cancer community.
We're also creating a global community. So because now we have international sites, it's really, again, it's heartwarming for us to see that the men are so engaged in the program. Now they want to communicate with each other. So in addition to having monthly video conferences for the New Zealand group, and of course for all Canada, now we're opening the gateway to putting those 2 communities in touch with one another. And that is just heartwarming. Yeah. We also have a conference coming up on April 1st. If any of you gents are in the program, of course, you will be invited to that conference, and also be invited to the many decisions we'll be making as far as where we're taking this program next.
Okay.
Good. And I'm excited to see the research paper in a couple of weeks.
Thanks for this opportunity, guys. Really appreciate this.
Yeah.
Hats off to you all.
Really appreciate it.
Yeah. Okay. And all the best.
Okay.
Thank you.
We'll talk again soon.
Agreed. Take care.
Thank you.
Take care, guys.
Good night, everyone.
Bye-bye.